So my name is LaRoche, and I'm going to shed a little light on the significance of public health. And let's explore how we can collectively drive positive change in Indigenous health through public health initiatives. I am a proud member of the Kuwichasha Oyate, located in LaRoche, South Dakota. I was born and raised. Both of my degrees are University of Minnesota, and like I said, I serve as the Native American Services Coordinator for the PHAP MPH program. I want to share three powerful images that I think really kind of capture a visual timeline of the impacts that we've faced as a community. And that chief, Mazoyate, he was my chief of my tribe. So we have various eras. We always have to go over a little bit of tribal history every time we present because we need folks to understand the context of why we're here, what we're doing, and what's the purpose moving forward. So as you can see from the Reorganization Act, and we actually were recognized, not until 1924 we became citizens. And a lot of our ways on our constitutions are very westernized, but now we are in a Native nation rebuilding era. And starting in 1776, the blue was originally traditional tribal lands. The red is now what it is today. 574 federally recognized tribes. This next set of pictures is my old, well, it's where I'm from in Lower Brule, known as Brule. The house right there lasted 20 years before it was torn down. It was known as the jungle. And in this timeline between 46 and 66, over 300,000 acres of additional farmland was lost along the Missouri River in South Dakota. These are some of the stats that we face right now. And even with 80% of natives living off the reservation, we still face these high rates: poverty, homicide, cancer, suicide. And it's all because of historical trauma. So here are some of the reservations right now. And one of the common factors is transportation, as it was mentioned earlier. Transportation, trying to go get proper health care, which leads to time off of work and additional funds. There are certain organizations right now. We have the IHS, National Indian Health Board, and the National Council of Urban Indian Health. They're great organizations that provide services and advance policy, but it still remains a challenge to reach everybody. And data collection and classification of Native Americans remains challenging. Current practices hinder our ability to address specific needs, emphasizing the importance of tribal data sovereignty. A couple of organizations right now that have been doing some great work creating and drawing awareness are these two podcasts: National Indian Health Board and Tribal Health, the podcast. They're actually really, really fun. I like to dork out on the weekends. It's very true when I go running, to listen to them. And then more Native Americans representation in public health means better policies, improved access to health care, and ultimately better outcomes for our communities. And I recently had the honor to listen to Dr. Melissa Walls, the co-director of the Center of Indigenous Health, and she showed this exact image. And it really hit me because over the 20-year span, there has been very little increase in public health-related master's and doctoral degrees for Native Americans in comparison to other racial minorities. That's how much I've paid for college. That is a huge hindrance. That $45,000 I start paying back on the 6th. I don't make that much. But it's not cheap. So I think in PHAP we are actively recruiting and supporting Native American students with scholarship and support services to improve their educational journey. We are continuing to learn from this path. It's new to us, it's new to the system, but we need to continue. And we are trying to create a pathway that not only provides quality public health education, but creates an environment where Natives can thrive. We need to find financial resources that would make our scholarship sustainable past 2025 to continue this and maintain this initiative, because Leah is spot on. Native representation matters as much as the classes and courses that focus on Native American public health. We have some incredible, valuable classes here, but we need to develop more. More focus on graduate classes, more Native American classes for the newly launched public health undergrad major, as well as programs to help high schoolers. Over the past year, with the help of SPH Comms and Chris Cooper, I had the opportunity to interview and learn from some amazing Native PHAP students and tribal leaders. You can scan that right there and see the video. And I'm really, really proud of this because I think it really shows what we're trying to do, who we are at the University of Minnesota, who we are in the Public Health Administration and Policy MPH program, as well as the university. Today's been a good day. I think this is a call to education, representation, access to resources as we can strive for a better future. Indigenous health is public health.